Good morning, Jeff. How are you?
Oh, good. Thank you very much. I appreciate you calling in during this very busy time, and welcome to the first state.
Hey, this is great. I'm very happy and privileged to be a Delawarean.
Came from, California, right?
Yeah, I came from Southern California.
And you took your position as president and CEO a few weeks early to help with what was the start of the pandemic here in Delaware.
Yeah, I was supposed to start April the 1st, but went ahead and started literally a month ago, actually 31 days ago.
Kind of a tough time to jump in head first, but from everybody in the area, they're just so glad that you're there and that you're a part of the Beebee Healthcare now. Tell me a little bit about your thoughts for joining during this pandemic.
Well, Jeff, first, it's a real privilege to be here. I will tell you that, to be perfectly frank, I'm not the one that's doing anything. It is really this amazing team of people here at Beebee Healthcare, what I call Team Beebee, who've really done an amazing job. I was driving across the country in my U-Haul and just my car, and it was just going to be the first kind of shipment. It was supposed to be my little mini vacation, to drive across the country. I'd done that many years ago when I was in the Navy. And just a really beautiful drive. I was going to relax and listen to books on tape. My wife called me up and said, this coronavirus thing is getting pretty bad. When I left on March 11th, it was just, of course, something that was going on in China. Maybe Italy was starting up, but really hadn't ramped up to where it was in Washington State and certainly other states in the country.
Sure.
And my wife and I talked and realized that if I was going to join the team, I needed to join at a time when the team could have used an extra pair of hands and not maybe 3 weeks later. So she agreed to the earlier start date. I called Dave Herbert, our board chair, and asked if I could do that, and kind of accelerated the drive. And here I am. Started on March 16th.
Well, definitely a difficult time and a difficult time for not just you, but all of the Beebee healthcare workers there as you deal with this pandemic. How is Beebee dealing with this as far as bed space? Are you near your capacity? What's going on inside the hospital?
Well, inside the hospital, we are prepared. I'll tell you that, over the last month, my entire presidency, we've really been focused on three things. One, we've really been focusing on doing as much as we can to screen and to test. And so you may have heard about our drive-through sites for testing people.
Yes.
People are calling in to our clinics, and if they don't have a doctor with us or without us, we have a hotline if they are concerned that they may have been exposed to somebody. And we screen them, and if they screen positive, that is, that they answer the questions that have been set as guidelines by the Center for Disease Control and the World Health Organization, we go ahead and refer them to one of our mobile sites for testing. And so we have three, and what we do is people stay in their car, and we actually do the testing. You put the swab in their nose, get a nasopharyngeal swab, and then we go ahead and get their information, do the testing, and then, if they're positive, they get called by us as well as the Department of Public Health, and we continue to follow and track them and their contacts as the Department of Public Health does. And we've done that a lot, and the reason for that, Jeff, is because at the end of the day, the data that we need to make sure that we know how to prepare, as well as how things will go for the future of the coastal towns, in the next couple months, will depend on our ability to get as much testing done of people. We've also, you might have heard a little bit about a COVID-19 relief fund. Our foundation opened up,
yes,
and we decided to go ahead and get a fund where we can use the money to pay directly the expenses associated with the COVID preparation. So we actually had a machine in our own hospital that checked, that did flu and something called RSV, respiratory syncytial virus testing. And that company that makes the machine just had developed a new capacity to do COVID testing. We needed to go ahead and buy the module and then what they call these reagent cartridges to be able to do that. And so we just actually started this past weekend where we now have selective capacity because the cartridges are still a little bit short. There's a national shortage, if you can imagine, and FEMA is prioritizing them to other parts of the country. But we've been working very hard with our senators and the governor to get some kits here. And so we actually have in-house testing right here at Beebee Healthcare starting this past weekend. Where
That's great.
The test result is actually 4 to 5 hours and not 4 to 5 days as it was prior when we were sending these tests out to out-of-state labs.
Now, how about the Abbott test? Have you received any of those, the quick 5 to 15-minute tests?
No, we have not, and there's two reasons for that. Number one, the test still requires a certain level of technology and machinery to run those tests in-house. We don't have that. Two, we don't see a need at this point for the 5 to 15-minute rapid test. And as you have probably heard, there's still a little bit of question scientifically about not the validity of the test, but something called the false negative rate of those tests. And so we've decided to stick with the Cepheid machine, which we have in-house, because we already have the technology. We had the capacity to ramp up. And for our purposes, 4 to 5 hours right now is enough. Now, if it turns out in the future we need more rapid testing than 4 to 5 hours, we may have to look at other technologies. But, for us, screening and testing was the first phase. And then you asked about the second part, which is really getting the hospital and the health system ready for the surge that will come. And so that was a critical element for us. A couple of things I did when I first started is, the Surgeon General and Center for Disease Control said all hospitals should stop elective surgeries and open up capacity to ensure that you have the ability to meet the surge.
Right.
And doing that actually reduced our volumes by almost 40%. Because we basically stopped doing a lot of these kinds of surgeries. Now, elective means that they're not absolutely necessary for life sustainment that day. They can be scheduled. That doesn't mean that they're not necessary because at some point many of these surgeries will need to be done to make sure that people have a reduction in suffering and pain, like a hernia surgery, if you can
Sure.
imagine. Is something that's not necessary right away unless it's incarcerated, but certainly something that we should be looking at and monitoring closely. But all those were canceled. And at that point, if you think about it as any business, you have less business coming in, less revenue. What do you do with your expenses? I elected to continue at that point to keep our staff on at a normal level staffing. Because, I wanted to make sure that they were employed. At that point, all the restaurants were closing, of course, in the coastal towns. A lot of people were being laid off, and it was critical for us to have a stable workforce. And so we elected to continue to employ our employees at the level that we would usually have with the kind of volume that we would usually have about now. And then the second thing was then to use those people to really cross-train them so that when the surge came, people who would not necessarily be in the hospital could do the hospital work as well. They would have to relearn a computer system or understand how a hospital worked if they were working in one of our outpatient clinics. And so we have been doing that over the last several weeks in preparation for the surge. And so when you ask how the hospital is doing, I think the hospital is prepared for the surge as best as we can. There's always refinement that can be done, but the people are feeling pretty stable. They're of course anxious. We know that there are tough times that will come, and we also know that this coronavirus is a very challenging enemy, if you will, using my sort of military
Sure.
talk. But I think that people feel as trained and as ready as possible as a team to be able to to fight back.
And when do the experts believe this surge will be hitting Delaware?
Well, that's a very good question, because the answer is it depends. Many of the national models have actually predicted that Delaware would be at our surge now. Clearly, we have not. And there are a couple things that modify those national models, because those national models are very specifically related to, if you will, academic medical centers, so large metropolitan areas where the population density is significantly different than someplace like Lewis or Rehoboth or Dewey or the rest of Sussex County. Number two, the peak also is not just dependent upon the rates of infection, but also on the population of the people. And you can, I know your station in Rehoboth, although I know your radio station covers everybody here.
Sure.
In the South Coastal area. Our population is different. We're an older population. Our population has, potentially many of the comorbidities, other illnesses that make someone at risk for getting sick from the infection. So coronavirus is the virus, COVID-19 is the infection and the disease state that comes from being infected by coronavirus. And so, we have a different population, and I think as a result, we are still in the point where we're seeing an upswing in the surge. And my hope, of course, is that we don't see a surge. My hope is that, the quick action that the governor took to close things down, and of course, extremely painful for everybody and the beaches, may have flattened the curve enough so that we don't see this peak demand that could overrun all the hospitals.
Right.
I will say that the third issue is that's an unknown for us as compared to other areas is the fact that we are an area that has a lot of people coming in and out of the state on a regular basis. And so that sort of migratory, transient migratory pattern could shift the curve a little bit and shift the peak times more than what the national models say. So we expected the surge to come sometime this week or next week, and then we'll just continue to monitor over the next couple weeks.
I know that your COVID-19 relief fund that Beebee has been asking for the public to donate items as well, everything from sanitizer to gloves to N95 masks. How are you on PPE supplies?
So we are right now good with PPE supplies, and I say that with a caveat because I don't want people to think that things are okay. I apologize. I was in the Navy for a long time, so if you think about the supplies that a force needs, it depends on the battle that they're fighting, right, and the tempo of the battle. We expect we have several levels, what we call our surge phase, where we are currently in phase one of the surge, which is really getting to the place of meeting our hospital's capacity. Now, the hospital is not as busy in terms of the number of patients, but our ICUs are busier than usual. So it's not really just the number of patients in the hospital, but what is the utilization of ICUs and ventilators and things like that. And as those are certainly ramped up, but we have enough PPE for that. What we are working on and what the COVID-19 Relief Fund has really helped us with is how to ensure that we have enough if we enter the next phase of the surge, at which point the utilization of things like masks, of gowns and things will be critical. We do not want to get to the place where you see in New York City when they are hitting the high levels of utilization, people having to wear garbage bags or things like that and not protecting themselves. Our goal is to have a force that is mission ready when the surge peaks in the next couple weeks.
And the restaurants in town have been really great to help a lot of the Beebee Healthcare workers with food. Many of them donating and bringing, your staff food during the week, as well as gift cards to spend, and I know we'll have Scott Kammerer on Friday from Sodell Concepts.
Yeah.
They're donating an entire day of proceeds coming up this Saturday to Beebee Healthcare.
Yeah, and I really appreciate your spreading the word, and I certainly appreciate Scott and everybody at Sodell, as well as all the other restaurants, in the hospital, and certainly the Shells, who have really helped to move this forward. I mean, the food does three things. Number one, from a gift card perspective, it helps our caregivers, because it's not just about when they're working here. It's so critical that they have that they have things that they can rely on when they go home. Would take food home as a takeout rather than just what's available to eat here in the cafeteria, if you know what I mean.
Sure.
Our families are just as concerned for the safety of our caregivers as the caregivers themselves. I think number two, it really binds the community together. You saw, the firefighters came and did their parade of support. It's
sure.
so incredible for our caregivers to see that, as they really come in every day with a level of anxiety. I mean, they are first responders. They're the real heroes of this whole thing. And then the third thing I will say is, by partnering and doing this with the gift cards, it's our opportunity also to give back to this amazing community, because I know the restaurants and the restaurant community is suffering, and by working together to support our caregivers, we also support our community partners, and ensure that they are working together with us, united in this whole effort.
That's great. Well, I want to thank you very much for joining us this morning and spreading, the word about your preparedness at Beebee. I do want to mention that if people do not have a provider, that they can call the Beebee COVID-19 screening line that you mentioned at 302-645-3200. You'll screen people and get them set up with the testing if it's needed.
So, Jeff, if I could just take 2 seconds.
Sure.
Please, if I could, everybody who's listening, we still believe that the surge is coming. If it doesn't, great. In the Navy I was taught, hope for the best, plan for the worst. This is not the time to let go. This is the time to continue the distancing as much as possible, to wash your hands, to stay healthy, and we'll all get through this together.
Well, Dr. David Tam, thank you so much for joining us this morning, and to you and everybody at Beebee Healthcare, a very safe and healthy days, weeks, and months ahead.
Thank you, Jeff. Stay well, and thank you very much.
You're welcome.